Blood supply to the brain and the spinal cord. The spinal cord is supplied by two arteries, anterior spinal artery and posterior spinal artery. They provide radicular arteries which enter the spinal cord substance. The brain is supplied by two main arteries also, the internal carotid artery and the vertebral artery. These two arteries form an arterial circular Willis at the ventral aspect of the brain. The internal carotid artery consists of the following parts: the cervical part, interpetrosal portion found in the petrosal sinus, intracavernous portion found in the cavernous sinus, the supraclinoid portion found above the anterior clinoid process. Most of its branches to the brain arise from the supraclinoid. The vertebral artery from the neck region transverses the foramina transversaria, except for the first cervical vertebra of the four upper six cervical vertebrae, in order to approach the basis pontis, where the two vertebral arteries join to form the basilar artery. The basilar artery communicates rostrally with the branches of the internal carotid artery to form the arterial circle of Willis, which is the main supply of the blood to the brain. The arterial circle has two terminal branches of the internal carotid artery as part of it, and they are the anterior cerebral artery and the continuation of the internal carotid artery itself, which is the middle cerebral artery. The two anterior cerebral arteries from right and left communicate in front by an anterior communicating artery, which completes the circle by joining the posterior cerebral branch of the arterial circle of Willis. The anterior and middle cerebral arteries supply the following structures by their branches: number 1, frontal lobe; number 2, upper part of the temporal lobe; number 3, parietal lobe; number 4, anterior portion of the basal ganglia; number 5, anterior portion of the thalamus. The posterior cerebral artery supplies: number 1, posterior part of the basal ganglia; 2, posterior portion of the thalamus; 3, occipital lobe; 4, medial-inferior portion of the temporal lobe. The arterial circle of Willis is formed at the base of the brain to support the blood supply to the brain, and the following are part of it: number 1, anterior communicating artery, which interconnects the anterior cerebral veins, anterior cerebral arteries; posterior communicating artery, proximal part of anterior cerebral artery, proximal part of middle cerebral artery, and the proximal part of the posterior cerebral artery. The arterial circle of Willis has branches which are circular, called circular branches, and they are divided into 4 groups: anterolateral group, anteromedial group, posterolateral group, and posteromedial group. The most important clinically is the anterolateral group, which forms the lateral striate artery called the artery of cerebral hemorrhage, because it supplies most of the internal capsule and is most easily damaged by the hypertensive stroke, causing pressure on the internal capsule and loss of blood supply to the posterior limb of the internal capsule, thereby damaging the corticospinal tract. The contralateral side of a lesion will be affected and paralyzed. This artery of cerebral hemorrhage also supplies the region surrounding the posterior limb of the internal capsule, such as the thalamus, and puts pressure on the same as a result of hemorrhage. Some of the branches that supply the thalamus may also supply the internal capsule, and hence may cause paralysis if damaged. They are thalamo-geniculate artery, which supplies the thalamus and the medial and lateral geniculate bodies; anterior choroidal artery, which supplies the posterior edge of the internal capsule and may cause problems with affection of the internal capsule itself. The internal carotid artery begins at the level of the upper border of the thyroid cartilage. It is separated from the external carotid artery by the following structures: pharyngeal branch of vagus, the styloid process, stylopharyngeus, styloglossus, and glossopharyngeal nerve. It moves upwards from this level and is separated from the internal jugular vein by the vagus nerve. It proceeds upwards to reach the base of the skull. Snubbing the foramen lacerum, it enters the carotid canal. It emerges at the middle cranial fossa, where it projects upwards above the clinoid process to form a siphon that projects at right angles to its proximal end. It finally divides into its two terminal branches, anterior cerebral artery and middle cerebral artery. It is divided into four parts along its course. The supraclinoid part gives off the following branches: anterior communicating artery, which interconnects the anterior cerebral arteries; anterior choroidal artery, it supplies the posterior edge of the internal capsule; posterior communicating artery, anterior cerebral artery, and then middle cerebral artery. These last two are its terminal branches. The anterior cerebral artery supplies the inner aspect of the cerebral hemispheres. Its branches include medial stride artery, orbital branch for the orbital plate, callosal-marginal artery, which supplies the corpus callosum, and then pericallosal artery. The middle cerebral artery, on the other hand, supplies mainly the external part of the brain and has the following branches: orbitofrontal artery, anterior parietal artery, posterior parietal artery, posterotemporal artery, anterotemporal artery, Rolandic artery, and the pre-Rolandic artery. And the Rolandic artery supplies the central sulcus, and the pre-Rolandic supplies the precentral gyrus and sulcus.